A new report suggests future pandemics could be swifter and more severe than what was seen when COVID-19 began spreading worldwide. For more, let's bring in Dr. Fahad Razak, provincial clinical lead with Ontario Health. Welcome, Dr. Razak. You worked on this report with other doctors and researchers. So what are the key recommendations?
Yeah, this report was put together by 6 Canadians and an international chair, and we went across the country to get the perspectives of people experiencing the pandemic and trying to respond to it. One of the most important recommendations that came out of this report was that advanced preparedness is essential. So when we looked at places around the world that were able to respond very quickly, a lot of the investments had happened ahead of time, before the pandemic. And so the subtitle of this report is "The Time to Act is Now," because truthfully, we don't know when that next crisis could be. It could be an infectious disease, but it could be wildfires or flooding or any other kind of crisis. And so that advanced preparedness is critical. Now, specifically, the kind of structures that we had recommended, importantly, we thought that it would be valuable to have a single federal advisory level committee that would provide advice for all Canadians. Many other countries have this, we do not, and we had to create new bodies in the middle of a crisis, which is very difficult, of course, when people are suffering. We also said that the reports from this advisory should be made publicly available because you want to combat misinformation as quickly as possible by that public release of information.
So how can we set up that system that would ensure we're better prepared than the previous pandemic?
Some of the critical things that we need to put in place now are we need to address the data gaps that exist within the country. So our system of government means that there are very strong provincial and territorial governments and a federal government. That's fine, but you need to have data sharing happening quickly so that you have line of sight on what's happening. I remember seeing Dr. Theresa Tam give press conferences where at times in the pandemic, because of that lack of data flow, she couldn't report, for example, how many people were acutely ill and on a ventilator across the country. That's something that you critically need to know as you're responding to a crisis. Another area is you need to really focus on having advanced preparedness, especially in groups that are expected to suffer disproportionately. For example, we had some of the worst outcomes in long-term care of any comparable country in terms of the number of people who were sick and died. But reports before the pandemic had already identified the risk factors in long-term care that would make it especially susceptible, the crowding, the staff that went from home to home to home. So those kind of issues need to be dealt with now. And then this federal structure that we suggest, that can be put together with input from the provinces and the territories and the federal government. We suggest that it should have broad expertise, not only infectious disease, but for example, education experts, because we saw school closures, aerosol experts and engineers, because we were interested in cleaning the air within buildings. And so you want to have that in place ahead of time so that the public can see it and trust that structure.
Very interesting. That is our time. We will have to leave it there. Dr. Fahad Razak, thank you very much for being here with us today.
Great to be with you, Renee. Thanks.